At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
Radiologists and heart specialists are developing new ways to identify heart disease through imaging. My guest today is Dr. Christopher Kraemer. He's board certified in internal medicine and cardiovascular diseases at the UVA Health System. Welcome to the show, Dr. Kraemer. So speak about what imaging tests are used to diagnose certain heart conditions and how easy is this process?
Thank you for having me, Melanie. There are actually 5 different tests that we use on a daily basis to evaluate heart conditions, and they all have their individual strengths and applications that we use them for. So we can discuss each of them in turn. The most commonly used heart test is echocardiography, or ultrasound, to image the heart. It is frequently used to assess the function of the heart muscle as well as the function of the heart valves. It is frequently used to screen patients for the first time who may present with shortness of breath and to look for reasons why they may be short of breath, whether there's a problem with the heart function, a cardiomyopathy, or a problem with a heart valve, either it's blocked or leaky. And so that's the most frequently used reason for echocardiography or ultrasound of the heart. Another commonly used heart imaging test is SPECT, S-P-E-C-T, which stands for Single Photon Emission Computed Tomography. It is a nuclear technique that involves taking images of the heart and looking at blood flow to the heart muscle. This is very commonly used to, again, assess blood flow in a stress test. So typically, a patient will walk on a treadmill until they're exhausted and go no further, and we will image the patient with SPECT at rest and after stress to look for problems with blood flow to detect blockages in the heart arteries that might lead to reductions in blood flow. And that's a very commonly used cardiac imaging test. A relative of SPECT is a test called PET, or positron emission tomography. It is somewhat less used. It is, in a sense, a better version of SPECT, but it is more costly and less available. It is used to, again, detect abnormalities in blood flow, but is much more quantitative than SPECT. It's particularly used in certain types of patients, especially those who are on the obese side. Another commonly used cardiac imaging test is MRI of the heart. MRI is a newer test that's only been available the last 10 or 15 years in heart patients, and it is used both for stress testing, but not with an exercise treadmill. For this, we would use a infusion of a medication that simulates exercise, the effect of exercise on the heart, and we measure blood flow. But in addition, MRI is often used in patients who have reduced heart muscle function or a cardiomyopathy, because its best indication is really to understand what has caused the heart muscle to decline in function. And that's a very common use of MRI in 2014. And lastly, a very exciting cardiac imaging test is computed tomography, or cardiac computed tomography, or CT. CT is an anatomic test. Many of the other tests we're talking about assess the function or blood flow. CT is really best at imaging the anatomy of the coronary arteries. So it gives us a three-dimensional snapshot of the coronary arteries, and it enables us to look at any blockages in the heart arteries. CT is best used as a test to exclude coronary artery disease in patients who are at low or maybe intermediate risk of having heart blockages, because its best use is to show when those arteries are completely normal.
Does somebody, Dr. Kraemer, have to be symptomatic to get some of these imaging tests, or are any of them sort of a yearly or an every 5 years screening process?
And we have something called appropriate use criteria in cardiovascular imaging, and we assess whether tests are appropriate to use as screening tests. And most of the tests I've talked about are really reserved for patients who are symptomatic, either having chest pain or shortness of breath or some symptom that points to an abnormality in their cardiac condition. Now, there are a couple of these tests that can be used for screening. I mentioned CT. There's a test called CT coronary calcium scoring, which is a test that doesn't use dye. It just looks at the heart with a little bit of radiation but no dye, and looks for calcium in the heart arteries. It turns out that calcium is a marker for the amount of atherosclerotic plaque in the heart arteries. And this test is useful for screening in patients who are at intermediate risk of heart disease and asymptomatic, because if they have a very high calcium score, that points to the need for very aggressive risk factor modification. And if one has a very low or zero calcium, then one can be less aggressive about risk factor modification. So of all of those tests, in terms of screening asymptomatic patient, calcium scoring is the one that is best used.
Speak about your research into improving cardiac imaging and how that's leading to better diagnosis for patients.
Sure. Well, we're very fortunate at the University of Virginia to have a very strong team in cardiovascular imaging research with individuals in cardiology, radiology, and medical imaging and biomedical engineering working together to improve cardiac imaging, make it more patient-friendly, faster, safer, with improved diagnostic accuracy. One of our major areas of research is in improving cardiovascular MRI, especially stress testing with MRI, making it more quantitative, more accurate, and faster and safer. Another area that UVA has worked on over many years is improving nuclear cardiac imaging, in particular SPECT and PET. And that's an area that we've had strong efforts for decades here at the University of Virginia.
Tell the listeners, why should someone come to UVA for their heart imaging and heart care, and also really your best advice for people who might suspect that they might have heart disease and what they can do about it?
Yeah, I think, as I mentioned, we have a very strong team in cardiology, radiology, and medical imaging, not only in making the correct diagnosis using these imaging tests that I've described, but taking outstanding care of the patient once heart disease is diagnosed. So I think in addition to having excellent care, we also have the latest imaging equipment in all of the imaging modalities that I mentioned: echo, SPECT, PET, MRI, and CT. We have the very latest in technology, and our physicists and engineers are improving the technology on a daily basis to make it even better at making the diagnosis. If a patient has symptoms that they think might be, or their primary care doctor think it might be a problem with their heart, the best is for their primary care doctor either to refer them to a cardiologist or UVA, or may primarily refer them for a test to evaluate their heart, which, if the patient is presenting with chest pain, some sort of stress test, either with SPECT or echocardiography or MRI, might be indicated. If the patient is short of breath, then perhaps a screening echocardiogram may be the first test that is ordered to look for problems with the heart muscle function or the valves of the heart.
Thank you so much. It's very exciting information. You're listening to UVA Health Systems Radio. And for more information on the UVA Heart and Vascular Center, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening, and have a great day.